Hello, welcome to Mayo Clinic. I'm Edward Ahn, and I'm a pediatric neurosurgeon. I came here about 2 years ago, and I'm originally from the East Coast, from Baltimore, Maryland. I did all my training out on the East Coast and was a faculty member of the Johns Hopkins Hospital for um, 11 years before making the move over here. And I have to say that I'm extremely delighted to be here, to be interacting with the residents here, to practice here. My practice in pediatric neurosurgery runs the whole gamut, and I and Dr. Daniels, along with Dr. Miller, have a comprehensive service with uh, the pediatric neurosurgery, and I think we offer a good experience for the residents. My specific areas of interest are in craniosynostosis, specifically with minimally invasive endoscopic treatment. Um, I also perform the fetal surgery for spinal bifida, and then also have an interest in pediatric neurovascular disease. But our practices are pretty wide, and I think you'll see a breadth of disease processes on the pediatric neurosurgery service. My research focuses on outcomes, for one, and I help a group of residents in our pediatric neurosurgery research group. We meet frequently to go over projects that basically mine a database of surgical and non-surgical cases, and I'm able to take residents through research projects and present them on an international and national level, and to prepare manuscripts. Um, so that's on the clinical side. On the basic side, we have an animal model for fetal hydrocephalus that we're working on, and that's where I spend my time in the laboratory. Um, I- some remarks about the Mayo Neurosurgery residency program that make it very special. And I wanted to say a few remarks, and I think you're going to see this and comment from many other faculty members, and that is the mentorship program. And that's something that with the mentorship model is makes it unique compared to several other residency programs that I've been a part of. And that is that for your block of time, you are assigned to a consultant. And I think the advantages are several fold. And one is that, the standard model is that, the resident is assigned to an operating room, and then you just kind of show up and show up to the case, and you develop the technical skills to manage that case, but you're sort of blind to all that went into in terms of the preoperative management and workup, and interactions with the patient, and then also the postoperative management, not just in the hospital, but also as an outpatient. And in this mentorship model, the residents are invested in the patient from the very beginning. So the residents are evaluating the images, if not meeting the patient one-on-one, and then is involved in the discussion, the indications, the risks of surgery, and then is involved in the surgical care of the patient. And then afterward, that resident will be linked to that mentor, and often able to follow that patient's care even after they leave the hospital. And I think that's a good model in preparing one to be a good neurosurgeon, not just in the operating room, but to have a successful practice, because you get to see how um, your mentor manages the practice and is successful in their own field. When I'm not in the hospital, I am on the golf course, and I have a sort of pipe dream of becoming a better golfer. And so that's where I am. But I have also found that unfortunately the golf skills have sort of skipped a generation, or actually didn't involve my generation at all. So the golf skills have translated into my son, who's a much better golfer, and he's a junior golfer. So what I do is, in my free time, if I'm not in Rochester, I'm out with him, taking him to junior tournaments and sort of living vicariously through him. So, but in any case, yeah, I still have a dream to kind of be a better golfer. And I see many parallels between the game of golf and what we do as neurosurgeons. So that's for later discussion if you're inclined to, and I'd love to discuss with you about that. And I look forward to your visit here, and I'm available for questions if you have it, and anything specific to pediatric neurosurgery, the research we do here, and golf. All right. Thanks for your visit, and look forward to meeting you in person.